All right, we're back, everybody, on a Monday night. Important topic that we are discussing tonight. Again, if you would like to join, you have a question, a comment, 737+. We'd love to hear from you. Dr. Katie Spencer is a pediatric psychologist from Vanderbilt Children's Hospital. The long version we know is Monroe Carell Jr. Children's Hospital at Vanderbilt. And Dr. Rosemary Hunter, a pediatrician, joining us as well as we talk about everything that our kids have been through the last couple of years. We've heard all about incidences of mental and emotional health issues with our kids and also learning loss. Good news, we reported just last week that metro schools and a lot of the testing now is coming out, kind of looking at how have the kids bounced back? Are they on the right track? And overall, so far, we got to give these kids credit, their parents, their families, guardians, because they are starting to bounce back. Still room for improvement, but, you know, educationally, it was tough. These kids lost a lot. It was just not the same as in person. All these school systems trying to do the right thing. And, you know, I said in the very beginning, I feel like if our leaders, and I'm not getting political, had just said, bear with us because things are going to change. Our advice is going to change. Our guidance is going to change. We haven't seen anything like this. We're going to try to get a vaccine in quickly, safely, but in the meantime, we may tell you to wear masks and take them off because you have to study as this goes along and more people contract the virus and you have to be patient. So, hopefully, the worst is behind us, although we know there's Omicron variants and this virus is going to be around. So we need to stay physically healthy, keep your immune system as healthy as possible, and just be a good citizen, you know, as well as you can. For kids, what about their immune system? What do you know about just in general, keeping these, like over the summertime, I want my kids to get out, you know, get out and play and get fresh air and eat the right foods.
Yes, those are all great strategies to help keeping your kids healthy. So a good diet, regular exercise. Of course, we always encourage hand washing, which kids are actually quite acclimated to these days with hand sanitizer.
This is a good sign, though, right?
And washing hands. Yes, it's a great sign. It's a great sign. And it's actually great protection against all kinds of viruses, not just the coronavirus. So, I do think in certain situations, especially in, let's say, crowded indoor areas, it's not a bad idea to wear a mask. You know, not everyone is vaccinated. Some people are contagious before they feel many symptoms. So, you know, if you have someone at your home who is immune suppressed or elderly, you want to be protecting them. It's never a wrong idea to wear a mask. I know people don't like masks. They're a bit of a pain. But it is a way to protect yourself and also protect those around you who might be more susceptible. So that's always an option. I believe that going back to school at this point, as far as I know, Metro will still have sort of an optional policy on mask wearing for children. But the healthy diet, exercise, washing your hands. If you feel ill, we do encourage you to, you know, take a little time to isolate or test or make sure what your symptoms really are before you go around others and potentially spread it.
The at-home tests are widely available now as well, and I have a couple that I keep just in case because, you know, the virus is still out there. We have infections. I mean, overall, it seems like the reinfection cases overall are okay. They're not making people very, very sick, although, you know, some people are still getting reinfected and getting sick. So it's out there. And again, I like what you said about the masks. You know, depending on the school district, what their policy is going to be, we will see in the next month. And I've just told people, I recently flew on a flight, and I would say about 30% of the people in the airport and on the flight were wearing masks. And I asked someone, if someone sat next to you on the flight who was wearing a mask and you could tell maybe they were nervous for it, if they ask you, would you mind wearing a mask during the flight to make me feel comfortable? Well, for me, no problem. It's a couple hours, I'm just gonna put the mask on and be considerate, you know? Not everyone's doing that, even whether you agree or not, but I hope kids will do the same when they go back to school and just be considerate, and parents will offer them the best advice. From a mental health standpoint, though, do medical pediatricians and psychologists, I mean, there's a lot of communication, right, about what you're seeing and what you're seeing.
Absolutely. I work
How does
side
that
by
work?
side with pediatricians every day in the children's hospital. So children who are admitted, I'm collaborating with them during rounds. In the community, there are psychologists and mental health providers that pediatricians communicate with as well. And I think we're still working towards even more integration as we see the importance of mental health as well.
And what are you learning as of right now, as we're finishing up summer and heading into this new school year, which mostly looks like it will be back in class?
Right.
About kids' health.
Right. Well, I think that we're seeing a lot of sick kids still in the children's hospital, and that we're staying busier in the summer months from a mental health crisis perspective as well. And so we're, trying to help prepare as best as we can with strong outpatient treatment plans to follow up for mental health resources.
All ages of kids? I mean, specific range that are being affected more?
I think it's pretty much all ages. I mean, most of the children we'll see in mental health crisis who come in for an assessment at Children's are over the age of 4, and we'll see them up until the age of 18.
You mentioned assessment. How do you assess and then decide a plan of action for treatment?
Right, that's a great question. There's many different pathways. One of them is through mobile crisis. So our patients will be assessed by them in our emergency room or the community. If someone's recommended for inpatient treatment, the next steps is to look for placement, and that can take some time. There's been a lot of children in need and not more beds to give them. So we're still working through kind of a period of time that they may have to be in the hospital waiting for placement.
How, again, if you're talking with a family about a treatment plan that you're trying to put together, this could be a week or two, it could be longer depending on what you assess is going on emotionally, right?
Absolutely. So typically the assessment will help us understand what level of care a child needs for mental health. So if they need an outpatient therapist, like many children may have, or if they need more intensive outpatient or inpatient treatment. So if they need inpatient, that may be about a week of care in a psychiatric hospital. And then if they have not been successful with inpatient, they may require something called residential care.
Where are we with medicine, pharmaceuticals? I have heard that there are some amazing breakthroughs happening with kind of class of drugs, whether they're antidepressants, and there's a whole bunch of them, anti-anxieties, on and on, that, now with a DNA test, you can really kind of narrow down, what class of drugs might be most effective. Is that right?
That's right. It's not as widely used as you may think, and I think that many psychiatrists that I know are still kind of following their evidence-based practices, and sometimes that is a trial and error approach.
It is. You may try something and it's
absolutely
not doing what you think, and then you can try something else.
Absolutely, yes.
All right. Another break we have to take. More questions coming up. I want to hear, how are your kids doing? And what are you doing to help them out? Call in. I know it's a nice night, everybody. 737+. We'll be right back.